Have you heard about intussusception? You've not heard about intussusception? Okay, let me tell you. Let me break it down for you. Mothers, listen to this. Intussusception is a very serious health condition that needs immediate action. Intussusception could lead to worse situation if you neglect it. It is very common in male children from 6 months to 3 years of age. What is intussusception? Let me break it down for you. Intussusception is a medical condition where the section of an intestine folds to the adjacent part, forming a telescope, like that of a telescope. So this telescoping action causes both food and fluid not to pass through. There will be bowel obstruction. That's why your child will start presenting with distended abdomen, sudden abdominal pain, recurrent to sausage marks, like a sausage form marks in the right abdomen, and then there will be intestinal blockage. So mothers, if you notice your child is having any of these symptoms that I've just mentioned, it's very necessary for you to rush your child to the hospital so that doctor will carry out an ultrasound, an investigation. Ultrasound will determine if your child have intussusception or not. Yes, the causes of intussusception is idiopathic, it is unknown. But in adults, it could be related to like tumors, polyps, or complications from surgery. But one of the predisposing factors of intussusception will be a viral infection, when there is a viral infection. So this intussusception causes blockage. So it's going to be cutting supply, both food and fluids, passing through the intestine, and there will be a distended abdomen, presence of distended abdomen. You understand? So it is very necessary for you to take action when you notice these symptoms in your kids. Yes, they are children. They cannot come and start saying, most especially the ones that cannot talk. They cannot come and start saying, Mom, my stomach, I'm having pain. Like I said, 6 months to 3 years of age. So if a child is 6 months of, obviously the child cannot talk. So the only thing you see is those symptoms, and then the child will start crying out loud. So it is very important for you to note these symptoms. In case you notice any of this in your kids, you just rush them to the hospital. It is a very serious health condition, trust me. Of course, when there is blockage, nothing is passing through, and the stomach is distended, is it not a serious condition? So it needs a very serious action. Yes, the doctor can carry out a air soluble contrast or an enema. So if this one fails, then the next thing the doctor will advise you is surgery. Yes, so the doctor will also explain the procedure to you and tell you what complications come out after the surgery is being carried out. So it is very important for you to know this.